Stroke is the leading cause of long-term disability in the United States. Almost 800,000 people suffer a stroke each year.
Although the risk of stroke increases as people age, there are steps you can take to reduce your own risk of stroke right now.
On this week's Health Talk, we're joined by a leading neurosurgeon, Dr. Joshua Marcus, who will give us the latest advice on stroke prevention.
So stay tuned for an interesting and very important Health Talk.
We're up next. Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss stroke prevention with Dr. Joshua Marcus. Dr. Marcus is a neurosurgeon with the Western Connecticut Health Network.
Thanks so much
and
for joining us.
And a repeat visitor to our show.
Yes,
Thanks
welcome.
for having me back. I appreciate it.
So just go ahead, Andrea.
Stroke is so important, isn't it? It really causes a lot of disability for many people, especially as they age.
Yeah, absolutely. Stroke is the third or fourth leading cause of death in the United States and third leading cause of death in Connecticut. But more important than that, it's the leading cause of permanent neurologic impairment or morbidity. So these are often patients who are severely impaired, unable to take care of themselves long-term, require long-term nursing home and rehabilitation.
People at home probably know a stroke has something to do with the brain, but maybe you could say something a little bit more detailed to explain what is a stroke for people at home.
Sure. Stroke is a broad term that describes damage to the brain, either damage as a result of bleeding, which makes up the minority of strokes, or damage as a result of a blockage in blood supply to the brain, not dissimilar than blockage of blood supply to the heart, where the brain is deprived of blood and oxygen for a period of time and subsequently tissue dies. And that makes up about 85% of strokes, called ischemic strokes.
And so, as you alluded to, we sometimes, we talk about that lack of blood flow to the heart as a heart attack, and some people have been calling strokes a brain attack, that kind of stroke.
Absolutely, and it's a similar way to think about it, except in some sense the brain is a very unforgiving organ.
I was just going to mention that. Yes, go ahead.
In the sense that without blood or oxygen, even for minutes, brain cells are dying. And unlike most other cells of the body, the brain and spinal cord cells do not regenerate. They do not regrow. We have no technology to regrow them right now.
So the whole goal then, if someone's having a stroke, is to save as much of that brain tissue as possible.
Exactly, is to get the blood vessel open, restore blood supply and oxygen and nutrients to the brain as fast as possible.
So let's take a step back, because it's better not to get a stroke than to have to treat it emergently. So, and there's a lot we know about risk factors for stroke, isn't there?
Absolutely.
And things that we can do. Sure.
And risk factors for stroke are, again, very similar to risk factors for heart attack. They are lifestyle factors. Smoking is a big one. Smoking is probably one of our leading causes of risk for stroke, in addition to lifestyle, cholesterol modification, as well as heart disease. Heart disease actually puts people at risk for stroke, specifically a heart condition known as atrial fibrillation.
We see a lot about that on television. I think a lot of people don't know what it is. Tell us about atrial fibrillation, how that gives you a stroke.
Sure. So atrial fibrillation is an abnormality in the waveform of the heart, in the heart's ability to deliver blood throughout its routine chambers. And as a result, the blood sort of sits somewhat stagnant for a period of time, and as blood is pooling and not constantly moving, it can form clots, and those clots can ultimately be sent up into the brain and block those blood vessels.
And I think that's now I'll put in my hematologist hat. Yeah, one of the very important things that keeps blood fluid is the movement of blood through the blood vessels and through the heart. And with atrial fibrillation, the top chambers of the heart are not pumping. They're really sort of just fibrillating. They're wiggling, and the blood pools there, and then you get clot formation, and then that can break off and cause a devastating stroke.
Sure, and what is called cardioembolic stroke, or it originates in the heart and then it embolizes or travels somewhere else into the brain, is one of the leading causes of ischemic stroke. And so recognition of atrial fibrillation and ultimately treatment of atrial fibrillation are very important risk factor modifications.
And that's really important, I think, to emphasize, because atrial fibrillation is quite common.
Absolutely. It's certainly a population of patients of all ages. I mean, there are certainly patients who have atrial fibrillation for no known reason. There are patients who have atrial fibrillation because they've had a previous heart attack, but it certainly affects a large percentage of patients, and not every patient with atrial fibrillation is treated the same way. Not everybody needs a medication like a Coumadin or Xarelto or something that we see on television all the time. Some patients get treated with aspirin. Some patients actually don't get treated at all.
And we understand how to do that because we understand risk factors along with that help to raise your risk of cardioembolic stroke with
and there
atrial
have been
fibrillation.
good medical studies
Very
kind
good
of
studies.
looking at
Exactly.
those treatments and outcomes.
But the highest risk person with atrial fibrillation could be at up to 28% risk of stroke annually.
Which is extraordinary. We're talking about more than 1 in 4 chance each year of having a stroke.
Right.
And those patients often have other conditions that combine with that atrial fibrillation to increase the risk of stroke, don't they?
Sure, absolutely. Other medical conditions such as diabetes, any other sort of heart disease, heart failure is a big one, or blood clotting disorders, any of the above can put you at risk for stroke in addition to just having atrial fibrillation.
And the traditional vascular risk factors add on to the atrial fibrillation to increase the risk of stroke.
Absolutely.
As well.
We haven't mentioned explicitly high blood pressure. How does high blood pressure interact with the risk of stroke?
Sure, high blood pressure is another big one. So high blood pressure and high cholesterol sort of go hand in hand. What they increase the stress on the blood vessels of the brain, and so as a result, the blood vessels of the brain, same as the blood vessels in your neck or in your legs, can develop stress and lead to narrowing over time. And as a result, those narrowing can further close off and result in an acute or sudden onset of blockage of blood supply to the brain.
Josh, there are a lot of ads on TV about screening for the blood vessels in the neck. I know there's some controversy around that, but do you want to say, I think we understand certain patients certainly are at high risk if they have narrowing of their carotid arteries. Do you want to say a few words about that and who should be getting ultrasounds?
Certainly. So, and these are ultrasounds that are often done by patients, either cardiologists or their primary care doctors, which is important. Sometimes you'll see that your doctor puts a stethoscope on your neck, and you're thinking, my heart's not there. And so they're listening for something, for an abnormality, that warning sign that you are at risk for a stroke. And so these are the patients who have abnormalities in the blood flow in those vessels that need ultrasounds or subsequently maybe need an MRI or CAT scan to try and treat that atherosclerosis of your carotid arteries before it becomes a stroke.
One of the times patients, especially in the hospital, or may get that kind of ultrasound is if they've had what's called a TIA or a mini stroke. Can you talk a little bit about mini strokes?
Sure. So TIA is a term that stands for transient ischemic attack. It looks like a stroke, it feels like a stroke, but it goes away on its own. And it can last up to 24 hours by definition. And oftentimes that is a major warning sign that you are at risk for a big stroke. You can be at upwards of 3 times the risk of stroke in the immediate few hours or days after that event happens. And so anytime someone has symptoms of that, we need to be extra concerned as to evaluate them. Do they have heart disease? Do they have carotid artery disease? Are there other things that we can treat to prevent that major stroke from happening? And
maybe you can describe what some of those symptoms and signs are so our viewers can be on alert.
Sure, absolutely. So anytime someone has trouble using one side of their body, whether it's their arm or their leg or their face is not symmetric, oftentimes we use an acronym called FAST, which is F standing for face, A standing for arm weakness, S standing for speech difficulty, either difficulty talking or difficulty understanding what you're saying, or speech that just doesn't make sense. And all of those things require T treatment immediately.
And so even if those symptoms have come and have gone, don't wait for 4 to 8 hours or just brush them off. Those are signs you really should get evaluated.
Absolutely. Even some numbness and tingling in the arm or leg that feels a little different than if your hand fell asleep and goes away pretty quickly. These are signs of a possible transient ischemic attack, especially in older patients, especially in patients with heart disease.
And I know that if you see such patients and they have a significant narrowing of their carotid arteries, a vascular surgeon can actually clean that artery out and reduce the risk of stroke substantially, or at the very least they could be on some certain agents that will reduce the risk.
A range of treatments from medical management with blood thinners like aspirin or Plavix versus placing a stent across that narrowing or using a balloon to blow that blood vessel narrowing larger. Or like you said, opening up the neck and cleaning that blood vessel out, scraping everything out and closing it back up.
we talked a little bit about high blood pressure, how it causes strokes, but it's a silent killer. Maybe you can say a little bit more about how important it is to know your blood pressure, and if you have high blood pressure, treat it continuously.
Right, absolutely. So it's important to have your blood pressure checked by your doctor, and for people who are at higher risk, have your blood pressure checked regularly. Some people need to do this at home or at the local pharmacy, but blood pressure is asymptomatic until it is very high, very dangerous, and can be fatal. And so it is important to be followed for blood pressure. It is important to take your medications on a regular basis. People feel like, well, I don't feel sick, I don't need this medication, and that is unfortunately a bad attitude for high blood pressure, because it gets high and it's damaging your blood vessels, your kidneys, your eyes, your brain, while you have no idea.
The good news is that we know that with good control of blood pressure, we have excellent data to say you really can reduce your risks for things like stroke and heart disease if you control that high blood pressure.
Absolutely, and it's important working with your doctor to make sure that your blood pressure is well controlled.
And it often doesn't go away with treatment. It's controlled with treatment, but just because your blood pressure normalizes, you shouldn't stop treatment.
Exactly.
And I think maybe somebody who's had major weight loss, that might correct their blood pressure, but generally it's a chronic disease.
Absolutely. It needs to be managed long term because the damage builds over time.
And we've got less than a minute. I was just going to say smoking. That we said a word about it, but I think we need to emphasize that people think of smoking and lung cancer, but it's got devastating effects far beyond that.
Absolutely. Smoking is a massive risk factor for stroke and heart attack. It's probably one of our leading risk factors for stroke and heart attack. It weakens your blood vessels. It predisposes the blood vessels to narrow. Smoking cessation is an immediate risk reduction for stroke and heart attack.
And if you have diabetes, control it. If you're at risk for diabetes, do what you can to prevent full-blown diabetes.
Absolutely.
That helps a lot too.
Sure.
Well, I think that's all we have time for in this section. I want to thank
important.
Dr. Joshua Monkers for joining
much.
us on the show.
We really appreciate all the important information that Dr. Marcus provided with us. And if you have questions and comments you'd like to share with us, please do send them to us at healthtalk@wchn.org.
Thanks for watching, and remember to control your blood pressure and don't smoke.
Be well.